Familial Chylomicronemia Syndrome, a rare and life-threatening genetic disorder that disrupts the body's ability to break down fats. Today, we're exploring what FCS is, how it's diagnosed, current management, and the latest breakthroughs in treatment changing the landscape for patients worldwide. Familial Chylomicronemia Syndrome, or FCS, is a rare autosomal recessive genetic disorder caused by mutations in genes essential for triglyceride metabolism. Most commonly, the LPL gene, but also GPI, HBP1, APOC2, APOA5, and LMF1. Without functional lipoprotein lipase, chylomicrons, the particles that carry dietary fats, build up in the bloodstream, causing triglyceride levels to skyrocket above 1,000 milligrams per deciliter. Patients with FCS often present with recurrent abdominal pain, acute pancreatitis, which can be life-threatening, eruptive xanthomas, small yellowish skin lesions, lipemia retinalis, a milky appearance of retinal blood vessels, and extremely high triglyceride readings that don't respond to standard therapies. Acute pancreatitis is the most serious complication, leading to hospitalizations, chronic pancreatic damage, and increased mortality risk. Diagnosing FCS begins with clinical suspicion in someone with severe hypertriglyceridemia, recurrent pancreatitis, and lack of secondary causes like poorly controlled diabetes or medications. Genetic testing confirms the diagnosis, but access and cost can be barriers in many countries. A proposed diagnostic tool by European experts uses low LDL and low BMI as flags for identifying patients who should undergo further genetic testing. For decades, the foundation of FCS management has been a lifelong ultra-low-fat diet, typically less than 10 to 15% of daily calories or less than 20 grams of fat per day, along with strict avoidance of alcohol and simple sugars. These dietary measures help lower triglyceride levels, but adherence is difficult, and many patients remain at high risk for pancreatitis despite dietary efforts. Standard triglyceride-lowering medications like fibrates, omega-3 fatty acids, and statins are largely ineffective in FCS because they don't address the fundamental genetic impairment. In December 2024, the FDA-approved Olezarsen, marketed as Tryngolza. This antisense oligonucleotide targets apolipoprotein C3, APOC3, a protein that inhibits triglyceride breakdown. By reducing APOC3, Olezarsen enhances triglyceride clearance. Phase 3 data demonstrated significant triglyceride reduction and fewer acute pancreatitis episodes compared with placebo, marking the first targeted therapy approved for FCS in the US. In November 2025, the FDA approved Plozasiran, branded Redemplo, a small interfering RNA, siRNA therapy that also lowers APOC3 production in liver cells. In the pivotal Palisade Phase 3 trial, Plozasiran reduced triglycerides by around 80% and cut acute pancreatitis risk by about 83% compared with baseline. These APOC3 targeted therapies transform FCS care, offering real hope beyond diet alone. Other strategies under investigation include new RNA-based agents targeting APOC3 with improved safety and dosing profiles, ANGPTL3 inhibitors, gene editing approaches such as CRISPR/Cas, 9 microsomal triglyceride transfer protein, MTP, inhibitors. Preliminary evidence suggests these could further broaden treatment options and tackle unmet needs in FCS care. Beyond numbers, these breakthroughs matter in quality of life. Fewer hospitalizations, less pain, and greater freedom in daily living. Long-term data and real-world access issues remain important areas of focus for clinicians and policymakers alike. Familial chylomicronemia syndrome is rare but devastating, historically defined by dietary restriction and limited options. Thanks to recent advances in pharmacotherapy, we stand at a turning point in FCS management, with targeted therapies, improved outcomes, and hope for patients worldwide. Thank you for watching. For more medical deep dives, subscribe Daddy Medi and click the notification bell.